ABC Listen. Podcasts, radio, news, music and more.
Lesbian, gay, bisexual, transgender, intersex, queer and asexual people face discrimination in all corners of the globe, as we know, but some governments are doing more to support and include people in these communities. Now, Victoria is the first state in Australia to have a commissioner for LGBTIQ+ communities. The third person to take on this commissioner role is Jo Ball, a long-standing advocate for these issues. And Jo joins me in the studio this morning. Jo, welcome and congratulations.
Thank you very much. First day, first morning.
And hanging out with me, lucky you. Can you tell us about your role and why you think it's important?
Look, I think that I want to take a step back and say that there are many Victorian commissioners. For those who don't know, there's a Human Rights Commissioner, there's a Pay Equity Commissioner, there's many multicultural commissioners, there's a Children and Young People's Commissioner, there's an Aboriginal Young People's Commissioner. There are many different types of commissioners, and I'll be one, which is the LGBTIQA+ Commissioner. My primary role is to listen to the needs of my community and their families and to work closely with them to support their health and well-being. I am here to be an advocate for my community too and within government.
And what are the key priorities for you in this role?
Yeah, my priority, as I was just saying, is to further the health and well-being of LGBTIQA+ Victorians and their families. The blueprint for achieving this is the 10-year strategy, the Victorian Pride in Our Futures 10-year strategy. In practice, this means equal rights and freedoms, equitable inclusion in accessible services, evidence-based decision-making, which is data collections, and safe, strong and sustainable communities. That's the 4 pillars. My challenge, of course, is to not let that strategy languish on a page, but to actually give it life and breath. That's the challenge, and I'm up for that challenge. The other challenge is that I need to respond to emerging needs as they come up.
What are emerging needs as you see them?
Look, one, of course, or not of course, because not everyone knows, but there is a PrEP shortage in Australia.
Explain what PrEP is. There's so many people that wouldn't know.
Thank you very much. Yeah. So PrEP is an important part in the fight against the transmission of HIV. AIDS is not over. We need to still respond to HIV transmission that largely does affect gay men, not just gay men. And PrEP is medication that people take to stop the transmission. Now, there's been a shortage of it in Australia and a shortage in Victoria. I'm yet to receive a formal briefing about this, but I'm well aware of it, and it's an emerging need, and we need to ensure that people are not going without this essential medication. And if people are concerned and listening to this now, they should go and see their GP or healthcare provider.
One of the other issues, and certainly David Spears raised it with Mark Butler yesterday, who's the health minister, is access for same-sex and queer couples to IVF, or at least government-supported, Medicare-funded, to some extent, IVF. Is that something that you think needs to be pursued?
I think that it's really important. I mean, we need to remember that it's only since 2017 that same-sex couples have been able to be married, and there's still lots of reform we need to do around our families. I mean, marriage is not necessarily having children, but there is still a lot of work to be done about us getting equal access to services, and we have rights to have a family, and we need to break down barriers that might be put up in place to that, which include financial and any discrimination that may come.
Now, of course, the rainbow has many letters in it, and that all of those experiences are actually vastly different. Mm-hmm. Does that make a role like yours difficult? I imagine the experience of a lesbian versus somebody who's trans is very different, right? How do you straddle those different communities in one role?
I think that's a great question, and I think that's sometimes where emerging needs come up, because we need to look at what are the needs of our community and also consult with our community regularly. And consultations need to be diverse and intersectional. They need to be across the alphabets, but they must be across the other parts, which is race, gender, disability, class. You know, we need to look at all parts of our rainbow. I think that there are challenges with representing the entire community, but I think that the strategy takes on principles like rights and freedoms and bodily autonomy, and that's something that unites everybody and everybody under the rainbow.
There are tensions among some people in the community between some of those identities, though. We've seen it play out in the courts. Is that difficult?
I think that it's on the public record that I'm a feminist. And I think that that is a uniting place about bodily autonomy. And I think that means that there is a lot of things we need to think about the choice and the rights of the individual to have control over their body and their destiny. And I think that's an issue that actually unites everyone. And if we get back to that principle, I think we can get out of the politicking, which can be about dividing people and a lot of the time spreading misinformation for political gain. And actually, I think a lot of people in our community actually agree with the same principles of the right to choose and the right to be who we are.
There's been a backlash to some of the ideas coming out of the trans community, I reckon, that we've seen really emerge, and a reconfiguration around politics. Is that difficult also to manage or to respond to?
What particularly do you mean by the backlash? Let me, you pinpoint it for me.
Oh,
if you can.
I will.
Okay.
Trans healthcare, particularly for young people. It's been really politicised, particularly, of course, in the United States, but in Australia there are people concerned too. And, of course, there are doctors who have different views within that medical community. How do you manage advocacy around that conflict?
I think it's really important to remember that we have a strong healthcare system here in Australia and that it is different to overseas, and that some of the inquiries that have taken place overseas, they have little to no relevance on the healthcare system here. You know, for example, unlike America, we have a public health care system which is excellent, and we have excellent clinicians. And I would say we have some of the best trans and gender diverse support clinicians in the world. We are also not the same as the NHS in England. People do get a different kind of service. And I would say that I'm very proud of that. And I know the clinicians at places from Royal Children's Hospital to Westmead are under scrutiny, and but that they are rising to the challenge. And I think that questions, in the evolution of health responses always need to be had. Conversations need to be had, but they need to be evidence-based. And what we're finding time and time again out of numerous reports is that Australia is coming up over and over again with providing excellent healthcare in this space. And I think a lot of the concerns that people have are often imported concerns or outright lies and misconceptions. And I just really encourage people to get back to the facts about what is actually happening. For example, sometimes there's myths spread about the rate under which people are accessing, children are accessing hormones and surgeries, but they are often highly inflated rates based on a percentage that might be from 10 to 20 people, and saying that is, the 50% increase in people who are accessing services, and it's not accurate. I think we need to bust through the misconceptions, and that's an important thing to do. I mean, that's a role that I've got to play, right? Is spreading, is working with communities, working with evidence base, working with data to show what is really actually happening in our communities and healthcare systems.
The Albanese government was criticised recently for wanting to dump some questions in the 2026 census around LGBTIQ plus issues. Then there was a reversal on sexuality, but not on trans issues. And then there was another reversal. It was quite the 2 weeks. What do you think happened there?
I think, at the end of the day, what I saw that happened is people across the community stood up for excellent data collection, which you don't always see. There were so many champions in the community, including my own minister that I worked to, Minister for Equality, Harriet Shing, who stood up and said, actually, we need to include these questions. We saw Headspace, we saw major universities, all these organisations, it was incredible, unite and say, actually, this is the data collection we need to see. And that was an incredible moment. You don't often see people getting really, really this excited about getting it right in data collection and this uniform. So I think that's what happened. I think it did put our community under unnecessary stress and concern. I think that's true. Hopefully people can take the win that has happened, but I do want to clearly say that in the next fortnight, one of my priorities is to meet with the ABS and the head of the census and have a conversation about what happened, and also to understand what are the concerns with asking the intersex question, because of course that was the question that was dropped and hasn't been picked up. And I want to understand that better and work with them to see when can we get an intersex question in a future census.
There were some reasons given about it being complicated. You don't buy it?
I think that I want to understand that better. I think there's something about that not all Australians understand what intersex is.
Which is probably true.
I think that's true. I think that the challenge there, though, with any data collection is that you need to go out there, there's 2 years to go, and you need to have a conversation about what intersex is and raise awareness. And I think that that's a challenge for me, is to be a champion around people understanding what intersex is. I think and when there is a greater understanding in the population, there can be no argument that the question can't be asked in the future.
What worries you most for this community?
I think that I'm concerned that when we look at the research, that our mental health and well-being is poor. And it's far poorer than most other communities. We have one of the highest rates of suicide that was shown, and also why people are suiciding, which was shown in the recent Victorian coronial inquest into 5 transgender women suiciding, which was found that one of the reasons that drove those suicides was access to accessible healthcare in a timely manner. And I think that is something that worries me. My background is in family violence prevention, suicide prevention, mental health, housing and homelessness, and I'm worried that in all those areas that I am passionate about and that I work in, that we're not seeing better outcomes. We're seeing worse outcomes year on year, and I think that I want to see that start to turn around, and I want to be part of that, and that's going to be part of my job. So just a small thing, a small challenge, but absolutely essential. I want to see a brighter future for LGBTIQA plus Victorians.
Joe Ball, congratulations and thanks for coming in.
Thank you very much for having me.
Joe Ball is the new Victorian Commissioner for LGBTIQA plus communities. You're listening to ABC Radio National Breakfast. Patricia Carvelis with you, 27 minutes past 8.
Think bigger about the world we live in. Ask your smart speaker to play ABC RN.